essential before, because not only do we prevent care when the people eventually fall sick and are unable to take care of themselves, but because of our number in the health system, we are also the people who identify the signs and symptoms before. So please pay attention and look at the signs and symptoms. Again, because it mimics a lot of diseases, as Dr. Rita has said, it is important that you are very, very vigilant to see that people who are falling sick over and over again and are not responding to treatment, you probably will start thinking about amyloidosis. Let me not attempt to be the expert here. I want to hand over to the team that is going to present, but I'm encouraging you. I know they are going to do their best. Also do your best. And I want to leave you on this note that your bad handwriting is better than good memory. So I want to see by hand those who have their notebooks and pens to pick notes. Good, good. So please write down all the stupid things. For all you know, those may just be the information that you will require throughout. Thank you very much, presenters, and I want to call on you to take the day, and I consider this as ceremony duly started. Thank you very much.
Okay, thank you. Yes, so the chairperson and moderator in chief. I am a moderator. She is a moderator in chief. So having spoken, it means that we can set the ball rolling. Dr. Abdul Razak Dode has been introduced already. He's going to give us insights into pathophysiology, which underpins a broad overview of the rare disease. With a round of applause, shall we welcome Dr. Dode.
Good morning. All right, so this morning I will take you through TRANSTHYRETIN amyloidosis. As he said, I will take you through the pathophysiology. I will take you through the clinical manifestations. I will take you through the multi-system manifestations. Then I would also take you through red flags that practicing physicians should take note. So you are all welcome to today's session. All right, so Elvis, you can roll it. All right, so I've already told them what will happen here. So let's go to the protein itself. Before this one. Before this one. Yes. All right, so hello, is it clear? All right, am I audible enough? All right, so protein has a functional three-dimensional shape that allows it to perform its core function. So one of the core functions is to transport oxygen. The next is to support catalytic chemical reactions. Then the third is to support structures in the human body. So then, when the protein fails to achieve its functional three-dimensional shape, what happens is it misfolds. And when it misfolds into toxic deposits. It misfolds into what? Toxic deposits in organs, and any other structure it will what? Find itself. So when that happens, the particular organ that it deposits, that particular organ is unable to what? Function effectively. All right, so let's go to the next slide. All right, so you can see up there, that's the normal heart. So the heart is supposed to what? Pump blood into circulation. That's the work of the heart, is to pump what? Blood into circulation. So oftentimes, the heart will receive blood from the system through the what? Right atrium, through to the what? Left what? Right ventricle, from the right atrium to the right ventricle. Then it goes back to the lungs for oxygenation. Then from the lungs, it moves to the what? Left atrium. Then from the left atrium, it moves to what? The left ventricle. Then from the left ventricle, it moves through the aorta into what? Circulation. So when this amyloid deposits, oh, you leave it there. Go back, you leave it there, I'm not done. So you realize that the up one is the normal heart. The heart muscle there, a magnification of it is normal, everything is fine with it. So that heart is able to what? Function effectively. But then you realize that where we've written amyloidosis, there is collection of what? Deposits. So once it collects it weakens the heart muscle. It does what? It weakens the heart muscle. So once it weakens the heart muscle, the heart is unable to what? Pump blood effectively into circulation. So once the heart is unable to pump blood effectively into circulation, what will happen? As we are all aware, it's ischemic blood conditions. The individual is unable to perform activities of daily living. The least activity, the individual becomes what? Stressed up. You have difficulty breathing. You have difficulty actually performing most tasks because you are not getting what? Enough or sufficient blood for the what? Organs and the systems to what? Work effectively well. So we can move to the next slide. So like I said, the protein in the human body are intricate, three-dimensional molecules that must fold into specific shapes to function properly, such as what? Transporting oxygen, catalyzing chemical reaction, and supporting what? Structures. We can go to the next one. So TRANSTHYRETIN amyloidosis, it's usually present as a multi-system disorder. Like the dean said, it affects more than one system. So just as it's affecting the cardiovascular system, it can also affect the musculoskeletal system and all the other systems. Then, oh no, you leave it there. Then we have the ATTR wild type. The ATTR wild type, it comes with what? Aging. It mostly affects males, but it can affect females. But the females are in the minority. So with the ATTR wild type, it has to do with what? Aging. So mostly older men after age 60, mostly between 60 and 65, they tend to what? Suffer the ATTR wild type. Then with that comes what? Cardiomyopathy. So with the cardiomyopathy, the individual will have what? An enlarged heart and heart muscles. So with that, the heart is unable to pump effectively well into circulation. So patients usually present with history of bilateral carpal tunnel syndrome. With the bilateral carpal tunnel syndrome, what it basically means is that the median nerve in the wrist, there is pressure on the median nerve in the wrist. So once there is pressure on the median nerve in the wrist, what will happen? The individual will have some numbness in the palm and fingers. There will be what? Pain pricking sensation, pin pricking sensation. You've all been pricked by pins before, right? Yeah, so there will be that pin pricking sensation, so in the palm. Then we have lumbar spinal stenosis. So with the lumbar spinal stenosis, the lumen in the spinal cord is narrowed. So once there is narrowing in the lumen of the spinal cord, what will happen? You realize that there will be pressure on the nerve that supplies what? The lower limbs. So once there is pressure on the nerve that supplies the lower limbs, what do you expect? There would again be what? Numbness. There will be that tingling sensation. Then sometimes you are unable to use the affected part effectively. Again, there will be bicep tendon rupture, which precedes heart failure by some many years. So with the bicep tendon rupture, there will be rupture around the bicep area that connects between the elbow and the shoulder. So with that, there will be some bulginess. The individual will feel some pain around the area, and there will be redness around the sites. But then all this will precede the individual getting heart attack in future. So we can move to the next slide. All right, so multi-system manifestation. So it affects what? The cardiovascular system. So it affects the heart. So once it affects the heart, the individual can suffer what? Heart failure. The individual can suffer what? Heart failure. So when the individual suffers heart failure, those are some of the signs and symptoms this individual will manifest. One of them is dyspnea. What is dyspnea? Dyspnea basically means difficulty in breathing. The individual would also suffer syncope. What is syncope? Syncope basically means fainting, temporary loss of consciousness. But this one is transient. Just within a short period, the individual comes backward alive. Then there can be pre-syncope. Pre-syncope basically means the individual will feel some lightheadedness, or feeling dizzy, or feeling like fainting, but would actually not faint. So that is what we call pre-syncope. Then again, there will be autopnea. Autopnea. So when the individual lies flat, the individual is breathless, unable to breathe. But when the same individual is put in a sitting up position, the individual is able to breathe normally. Are we together? All right. So there will be, no, I'm not done. There will be peripheral edema. Peripheral edema basically means there will be edema at the lower limbs and the upper limbs. Are we getting it? The lower limbs and the upper limbs. Then there will be ascites with congestive hepatopathy. So basically there will be accumulation of what? Fluids in the abdominal cavity. And this is because the liver is unable to what? Work effectively well. All right, so they would send this client or whoever suffers heart failure to the, how will I put it, where they would have to do the diagnosis. So we would have to do ECG. So ECG basically means electrocardiogram. So when they do the electrocardiogram, there will be arterial fibrillation, or there will be what? Flutter. So with the arterial fibrillation, what you will realize is that the upper chamber of the heart, there will be abnormal electrical signals in the upper chamber of the heart. So the abnormal electrical signals in the upper chamber of the heart will make the heart to work violently. So once it works violently, when you check the electrical reading, there will be abnormal what? Reading of the electrical signals. All right, then there will be flutter. With flutter, the heart works in a coordinated manner. The heart is already working in a coordinated manner, but at a faster rate. So because the heart is working in a coordinated manner and at a faster rate, what happens? The pulse rate of such an individual is above 100. It goes above 100, sometimes 120 and above. When you check the pulse rate, and when you check the electrical signal, it's also what? Quite different from the normal. So we can go to the next one. Let's go to the next. Yes, so you see, the picture on the left is the normal heart with the normal electrical signals. Then the one on the left, as I said, you can see the abnormal electrical signals in the upper chamber of the heart. So that leads to what? The arterial fibrillation, as it is what? Depicted. All right, so if you are in the hospital and the client goes to do ECG, and they come, you will see that instead of the blue is the normal reading, you see that the rhythm and the flow is normal and it's organized. But with the red, as you can see, is abnormal. So with that, you're able to tell that this individual is having what? Arterial fibrillation. All right, so let's go to the next slide. All right, so you can see the reading, the abnormal reading of arterial fibrillation, then arterial flattening. They are all abnormal. All right, so let's go to the next one. So in the hospital, when you see something like this, you should be able to interpret that the client has issues and needs to be attended to. All right, so there is neurological effect. So when there is neurological effect, it can affect the brain, the spinal cord, and the nerves. So the neurological effect, it can affect the brain, the spinal cord, and the nerves. So when we say peripheral neuropathy, it means damage to the nerves outside the brain and the spinal cord. Damage to the brain, to the nerves outside the brain and the spinal cord. That's basically what it means when you see peripheral neuropathy. So they say length-dependent sensory motor neuropathy. So what it means is that the individual will begin to manifest the symptoms from the feet. Then from the feet, it moves to the ankle. Then from the ankle, it moves to the legs. Then it radiates to it gets to the upper limbs and affects the hands as well. Again, as I said, numbness. So you feel the numbness sensation because there is insufficient supply of blood to that affected part. Then there is paresthesia. With paresthesia, the individual feels some pain, pricking sensation, itchiness, and pain all in one. So that is what we call the paresthesia. Then there is distal weakness. With the distal weakness, as I said, the part that is affected, the individual is unable to use it effectively well. That is what we say distal weakness. Then there is autonomic neuropathy. So with the autonomic neuropathy, the involuntary activities of the human system, the nerve that control the involuntary activities of the human system is affected. So with that comes, it now affects your blood pressure. The individual is unable to manage his blood pressure. It's because there is autonomic neuropathy. Then it also affects the gastrointestinal system. That's another thing it does. Then there is orthostatic hypotension. When I say orthostatic hypotension, what it basically means is that within 3 minutes of the individual getting up, the individual's blood pressure drops to the lowest minimum. And that is what we refer to as orthostatic hypotension. And this is as a result of damage to the nerves that control involuntary movement or activities in the human body. All right. Then there is There is diarrhea, there is constipation. We all know diarrhea, watery stool over a period, number of times over a period, or constipation. So the individual is unable to what? Empty his bowels over a certain period. What is normal it seems not to be normal for this individual. If it's that every 2 days, the individual is able to go to toilet and empty his bowels or her bowels. With this, the individual, it might take a whole week and the individual is unable to what? Empty his bowels. All right. There is erectile dysfunction. This one is very, very important. Erectile dysfunction. As I told you, once the nerves are damaged, you get the opportunity to express your feelings and you are unable to do it because your thing don't die. Or you don't do so. You don't do so. So you see that when you are even approaching the ladies, they even get offended. But that this man will waste my time. But it's not the man's fault. It's because of the damage of the nerve. Then again, they can be what? Urine retention or incontinence. So with the urine retention, as I said, it's because there is damage to the nerve that controls what? Controlling the what? The bladder and all those. That is why the individual will suffer that. So let's go to the next one. It affects the musculoskeletal system. So once it affects the musculoskeletal system, what happens? There is carpal tunnel syndrome. And as I told you, carpal tunnel syndrome, it affects both what? Hands. There is pressure in the median nerve in the wrist. So once there is pressure in the median nerve in the wrist, what happens? There will be numbness, tingling sensation, pain in the hands and what? Fingers. Then there will be spinal manifestation, spinal stenosis. What is lumbar spinal stenosis? It tells you that the lumen in the spinal cord has become what? Narrow. So once it becomes narrow, it puts pressure on the nerves at that side. So once there is pressure, it affects what? The lower limbs. Then comes with what? Numbness, the pain, the feeling, the tingling sensation, and the rest. All right. There is gastrointestinal manifestation. So with gastrointestinal manifestation, there is something called early satiety. What is early satiety? You see that they will prepare this individual's favorite meal. Once they prepare the individual's favorite meal, what happens? The individual is able to even take what? A ball or two. Just catch 1, 2, and the fellow is already full. The fellow is full because of what? The condition he or she is going through. But mostly it's the he, and the she is the minority. Then the individual can also suffer weight loss. There can be diarrhea, there can be constipation. Then there can be malabsorption. You know the small intestine is supposed to absorb what? Nutrients when we eat. So because of amyloidosis, the small intestine is not able to what? Absorb the nutrients, the protein, the whatever, the carbohydrates and everything. It goes waste. So you realize that when such an individual goes to poo or goes to empty the bowel, there will be this frothy stool. The frothy stool, they are difficult to flush. Have you all experienced that? You flush and get tired. So that tells you that the small intestine at the time was not able to what? Absorb the nutrients when you ate whatever meal you ate. So you have to look for a bucket of water and push it down, whether it likes it or not. You know, so? All right, okay. So once you experience that, it tells you that the small intestine is unable to what? Absorb the required nutrients. Then there is renal system effects. So with the renal system effect, what happens? Usually there is what? Nephrotic syndrome. There is nephrotic syndrome because the vessel that allows the kidneys to what? Filter waste, which is the glomeruli. The glomeruli is what? Affected. So once it's affected, the individual begins to what? Manifest certain symptoms. What are some of the symptoms this individual will manifest? One of them is the individual will have some puffy face. There will be some puffy face. There will be swelling of the feet and ankle. There will be swelling of the feet and ankle. And this individual struggles to even breathe. So that tells you the individual has what? nephrotic syndrome. Then again, there will be ocular manifestation. So with the ocular manifestation, we would have vitreous opacities. So when this individual suffers visual opacity, you realize that in a plain field, where the individual is supposed to see something plain, this individual will begin to see some spots and lines in between the plain field. It tells you this individual has what? Virtual opacity. Then there will be glaucoma. Glaucoma means the optic nerve is damaged. So the optic nerve is damaged beyond repairs. So it leads to what? Permanent blindness. So once it gets there, this individual suffers what? Permanent blindness. So when you have an old person in the house who could see, but at a point lost the eyesight, we can link it to what? TRANSTHYRETIN amyloidosis. Are we together? All right. So we have ATTR amyloidosis, the subtype. This one has to do with genetic mutation. And this one is hereditary. So with this, the symptoms are virtually the same. You can see the ocular manifestation, bilateral carpal tunnel syndrome, impairment of what? Renal function, peripheral sensory motor neuropathy, gastrointestinal changes like I've said in the previous one. Then there will be what? Cardiomyopathy, enlargement of the heart and the heart muscles, for which reason the heart is unable to what? Pump blood effectively well into circulation. All right, so let's go to the next one. All right, so now let's look at the red flags for the attending physician. So if you are in the hospital or you are assisting the physician in any way possible, these are some of the red flags you can help the physician to what? Identify. So in any adult with heart failure or left ventricular hypertrophy or neuropathy or multi-system disease, a clinician should have disproportionate what? Low QRS, so low what? Electrical signals. This should tell you the physician should pick the signal that is possible